Dr. Kemi for Kemi Talks Media. It's Saturday, the 28th of December, 2024. Let's talk about Bobrisky and this surgery that Bob just did. Bobrisky is now a transgender individual, and Bobrisky basically told us that he's now a woman. He made this post yesterday, and this post says, as 2024 is ending, I want to thank all my doctors who worked on my transition into a woman. I look at myself and clap for myself for going under different knives successfully. My last surgery took 16 hours in the theater, and I could not pee for 2 months. Now baby girl can spread them legs. Okay, this post is just to celebrate that he's now free of medical issues. And it's very hard to explain to Nigerians what transgender surgery is, because we are a country that has homophobic laws. We have an anti-gay law. So I'm going to carefully explain to you what a transgender is, because right now the transgender initiative is very controversial right now in the United States because of the new things going on with the underage kids in high school. 14, 15-year-old teenagers are saying they weren't born as a woman, they want to be a man. They weren't born as a man, they want to be a woman, and they're going to have the surgery without parental consent, and some parents are even letting them do it, and some states have banned it, and other young people are going out of state with their parents to go change their sex. And I think it's really whack and gone overboard. You can hear President Trump saying he's going to crack down on it. But transgender surgery has been happening for years in America. When I was a teenager in America at 18 years old, there were many trans people that would go change their sex. They called it sex change surgery at that time. However, today they have new names like gender affirmation surgery, okay, which refers to procedures that that help people transition to their gender. Gender affirming options may include facial surgery. You want your face to look like a woman or a man. You want hair on your face. Top surgery and bottom surgery. Some people change the top of their body because they want to wear implants on their breast so it looks big. Bottom, they want a penis instead of a vagina, and so on and so forth. So most people choose gender affirmation surgeries and they report satisfaction with the results, like Bobrisky just reported to us now, including the way the body looks and works, and also the improved quality. Now, that was Cleveland Clinic, a major clinic in America that knows about this. Now, what is the male to female transgender procedure? This is Bobrisky. Bobrisky was born as a male. Now he's a woman. The most common technique is penile inversion. Now, penile inversion means, it's usually part of the glands, the penis, the head of the penis. They use it to make a clitoris, the skin of the shaft to make the vagina, and part of the scrotum to make the labia. So they're taking the penis and they're using it to make a vagina. That's basically what Bobrisky has done here. Now, I know how it sounds disgusting and everything, but this is just what it is, okay? I'm not for sex changes and anything, okay? I've never done any kind of surgery in my life. I've never cut any part of my body to enhance it. None of that, but some people do it. Now, the depth varies depending on the donor tissue, and the new vaginal obviously terminates in a dead end, and there's not a cervix. Can they have children? No. Okay, people also ask, this I pulled from Google, what actually happens in transgender surgery? Removing the testicles, okay? If you want to be a woman and you're a man, they will remove your testicles, okay? That's orchiectomy. And removing and reshaping tissue from the penis to make a vulva, penectomy, so that they can actually have sex with a man, okay, when they become a woman. This includes creating external labia or lips, camel toe area, and a clitoris, vulvoplasty. These things are very expensive. Shortening the urethra, okay, the tube that they urinate from, creating a vaginal canal. Okay, that part, vaginoplasty, some people skip that. It depends. What are the side effects of male to female surgery? Like any other type of major surgery, many types of feminizing surgery poses a risk: bleeding, infection, and reaction to anesthetic. What may Bobrisky encounter later on, you never know. Anything. Could be bleeding, could be infection, anything. But wish him well. Depending on the procedures, other health concerns can also happen too. All right. Delayed wound healed, healing. When it takes forever for the wounds to heal. Fluid buildup beneath the skin, which is called seroma. I don't like these things because I believe firmly that if you're made a man, you should be a man. If you're made a woman, you should be a woman. This is why some people choose to be cross dressers. And that's how Bobrisky started. They'd rather be cross dressers, do it for the fun, the money, the fame, the clouds. Most cross dressers do it for that. But when you start changing your gender, it's a different thing altogether. This is Bobrisky now, all woman. Congratulations to him and good luck. Take care of your health. That's all I'll say. Thanks for listening.